Okay, the next one, we have here your Enterobius vermicularis. Other name for that is your seatworm, pinworm, or your Oxyuris vermicularis. Okay, for the morphology of the worm, so adult worm would have here, basically this one, spindle shape, and would have here the presence of the pair of lateral articular extension. You call it was your lateral wings or cephalic alley. So at the cephalic at the head part, these alates serve as their mode of their attachment in order for the adult worm to attach to your intestinal mucosa. For the male, I measure 2 to 5 millimeters, so it's much smaller compared to your Ascaris lubricoides because it's millimeters. And would have also here again the curved posterior end tail. For the female, measure 8 to 13 millimeter, would have your straight posterior end tail and able to lay approximately 11,000 eggs per day. For its egg, it would have your characteristic lopsided or D-shaped ova. It's D-shaped because, again, one side is flattened, the other one is, okay, one side is flattened, the other one is elongated. And this is a very, okay, whatever this is a two-layer eggshell or double-walled eggshell. And again, the ova here is embryonated already or partly embryonated, where approximately a few hours after oviposition, it would already embryonate and that would hatch easily. And doesn't require soil for it then to embryonate. Okay, then for the life cycle of your Enterobius vermicularis, again, the infective stage will still be your embryonated ova. And again, the embryonated ova here do not require soil for it to embryonaite. You get infected here by your Enterobius vermicularis by several methods aside from your ingestion. So once you have acquired here the embryonated egg, it go to your MES. In your stomach, it would hatch to liberate the larva, and the larva migrate to your intestinal tract, going to your large intestine. Because again, the large intestine serve here as the final habitat for the adult worm. Okay, and then in the large intestine, the male and female adult worm try to copulate. And then time will come here that the female adult worm try to lay egg. As it try to lay egg, from the large intestine, it try to migrate to the outer area of your anus where it try to lay their eggs. Upon oviposition, remember that the egg is partly embryonated, and after a few time, like in room temperature or in body temperature, 37, it would already hatch after 6 hours. Once it's hatched here, once the larva try to hatch here out of the egg in the anus area, it might have the tendency to return back to your body, papasok siya sa loob ulit. And that become here the retroinfection or the reinfection process. Okay, so sometimes here, if the egg has been shed on the other part or other area, or like maybe in your bedding, so it might then acquire that one and then the cycle here try to go on. Okay, then we have here the different modes or method of transmission of your pinworm infection. So you can get infected here by number one, we have your hand-mouth transmission, primarily by finger contamination, especially if since one of the manifestation would be the pruritus ani, or intense itchiness to try to scratch the anal area where you have that parasite on that, and try to put your mouth in your put your hand in your mouth, contaminated hand, and therefore you try to ingest the ova with that, and you get infected. Another mode of transmission would be inhalation, because again, the egg here could lodge in the linens or even tabletops, and you can get infected by that. Third one is your retroinfection. That's what we have discussed. Since again, as the female worm try to lay egg on the anus area, it hatch easily, and then the larva try to liberate from your egg, and then larva go back to your body to become a retroinfection or reinfection. Okay, then we have here manifestation. So, okay, we have here, okay, it would provide your minute ulceration, intestinal mucosa, because it is where, because of the attachment of the adult worm in that area and try to cause infection or ulceration in your intestinal mucosa. And then also because of the migration of the adult worm, female adult worm, the one trying to lay eggs on the night here. So it would have result to pruritus ani or intense itchiness in the anal area, where to try to scratch that one, that would cause here some discomfort. And of course also here we have here the absence or the lack of the sleep because of the irritability brought about by that one. The second one, because sometimes of too much scratching the area, it might result here to some secondary bacterial infection because of the itchiness, because of trying to scratch that one. So pag scratch mo, nasusugat siya, and it might result here to your bacterial infections. Third one, it might also cause your extraintestinal infection, especially for the female patients. And because of the anatomy of the female reproductive organ, their urethra is also near, most likely, to the, their anal, their anal canal is much more likely near to their reproductive organ. And it might have the tendency that the larva might migrate to that other part of the body, especially for the female reproductive organ. It might have infects the appendix, might infect the vagina, the uterus, or even the fallopian tube. Okay, how are we going to diagnose for the infection? So we could have here stool sample for examination for the presence of the egg. But better recovery of the egg here, not by stool examination, but by your scotch tape method. We'll try to put scotch tape on the anal area and then try to remove the scotch tape and put it on the slide for examination of your D shape or lopsided egg or the ova of your Enteropus vermicularis. Okay, that's we call this one your scotch tape, cellulose tape, or we have also here the Brahman scotch tape. Okay, when are you going to collect the specimen? So the best time, okay, will be as soon as the patient arises from sleep. So early in the morning, before the patient take a bath and before the patient try to urinate in the case of the female patient to prevent the washing off of the ova on the anal area in order for you to recover the parasite. Okay, you could also modify your scotch tape. You could add here your iodine with a xylol solution in order for you to have a better staining of the for you then to identify that one. Because if you do not put a stain on that like this one, so the ova appears to be colorless, just like our scotch tape, and sometimes it would be very difficult for you to identify that the ova of that. Okay, so we consider here your Enterobius vermiculars infection as a mother's complex. So, speak about the mother's complex. So, once the children most likely will have the infection, it's most likely it would infect the entire family because, again, the egg might have the tendency to go to the air and eventually might contaminate and might infect it if it's trying to inhale the air or even the linens or tabletops, all of that one containing here the ova coming from one of the members of your family being infected. Or even you could infect the mother because of that. Okay, the next one, we have here your trichura. Other name for that is your whipworm or your whipworm. Other name for that is your trichocephalus dispar. So try to consider the whipworm infection, trichoriasis, or your doriard infection. Okay, for the morphology, the adult worm would have here fleshy or pinkish in appearance with the presence of extension in its posterior end tail. Most likely, the posterior end tail would have here the presence of your whip-like projection, which right occupies approximately two-thirds of the entire body length. And that's whip-like projections being used here of the parasite in order for that to attach to your intestinal mucosa. If adult male measure 3 to 4.5 centimeters, and again, this would be much shorter compared or smaller compared to the female adult worm. And then would have your typical characteristic of the male adult worm, which is curved posterior end tail. But the curve here is able to form approximately 360 degrees curve. For the female, measure 3.5 to 5 centimeters, and this one would have your blunt or straight posterior end tail, able to lay approximately 5,000 to 7,000 eggs per day. For the egg, okay, that one would have your characteristics lemon shape, barrel shape, football shape, or Japanese lantern. So characteristic of that, we have the lemon shape with bipolar plugs. And the bipolar plug here try to protrude. Protrude siya. Okay, and making that one as your lemon shape with the bipolar plug. Okay, then we have here the life cycle of your trichura, almost the same as with our Ascaris lumbricoides. You get infected by your trichura by ingestion of your embryonated ova. And the ova laid by the female adult worm is unembryonated. For that to undergo embryonation, it needs to go to the soil just like your Ascaris lumbricoides. Aedes lumbricoides, making this one as one of your SDH alongside with your Ascaris lumbricoides. Once you go to the soil and undergo embryonation, it become infective stage. Once you ingest marinated ova, go to your MES, and then try to hatch here in your small intestine, or in stomach, small intestine, um, in the stomach, I try to hatch and eventually try to liberate your larva. The larva migrate and go to the large intestine where it try to develop here to become adult worm. Developing to become male and female adult worm, they try to copulate. Then time will come, the female adult worm will going to lay egg. And then the egg shed here by your female adult worm in the stool or feces of infected patient is unembryonated. So mean to say the egg still need go to the soil in order for that to undergo embryonation to become infected. Okay, then we have here the different disease pathology related to your trachea infection or the whipworm infection. The first one we have here the anemia. The patient infected by your trachea experience anemia because the parasite tried to shed here the blood, approximately 0.05 ml the blood per day per adult organism. So just imagine how many adult of that is infected in your body. So it would equivalent to in every adult worm, it try to penetrate or you are shedding approximately 0.05 ml of blood per day. Then you also experience diarrhea, abdominal pain, nausea, vomiting. Then we have also here weight loss and the characteristic rectal prolapse or prolapsus recti. So this characterized here by the primarily characterized here by try to lose here the elasticity of your muscles here in your intestinal tract because of repeated voiding. So dominant patient, and time will come here it try to loosen the elasticity of the smooth muscles where the large intestine try to protrude outside the body. And you call it once your rectal prolapse, especially in the case of your chronic heavy infection. To diagnose the infection, then you could have stool sample identified through your DFS, direct fecal smear. You could also recover the stool here, recover the ova in the stool through your concentration techniques. Okay, thank you for this app.